Hi everyone, coming to you from East Liverpool City Hospital. I'm here with Dr. Harshaw and Dr. Nickel to give you another update. Again, we're trying to be as proactive as possible. It's imperative, absolutely imperative, that we keep listening to our healthcare professionals, and they're going to speak on what we need to keep doing to prevent this virus from spreading even farther. But again, I'm asking for full cooperation from our residents. We've been in constant contact with Dr. Nickel and everyone from the hospital. So again, East Liverpool City Hospital is doing a phenomenal job on their end on preventing this from spreading. So I'll turn it over to the doctors on what we need to keep doing.
The prevention mainly is we need to recognize the symptoms which are most common with the disease, and those three symptoms that you want to look for are fever, shortness of breath, and cough. And then recognize that once you have those symptoms, that you need to either be triaged into a category where you need to be in the hospital, or it's something where you can quarantine yourself at home.
And once that happens and you do feel that you need medical care, what we have been working with the surrounding primary care physicians is to create one central location where you can go to be tested. We are now up and operational with that center within East Liverpool City Hospital. There will be signs there directing you where you need to go. If you are not sure, you can always go to the emergency department. There are people there who are able to direct you to the correct location. If you have severe symptoms, they will check you there and immediately take you into the emergency department so that you could be further evaluated in the actual emergency department rather than the testing center. At the testing center, they'll be able to check you to see if you qualify to be tested. Not all individuals need to be tested. If you are tested, the kit is taking about 3 days to 7 days to obtain a result. So we will not know for a certain period of time. During that period of time, we are recommending that those people who are ill, even if it's mild symptoms, do a self-isolation for 14 days, or if they've been tested, until the test comes back saying that they do not have COVID-19.
And I think another thing that we need to practice is, to prevent the spread is, good hand hygiene, washing your hands, cleaning surfaces that, come into contact daily, and, avoiding, if at all possible, larger groups of people and larger gatherings.
Now is not the time for handshaking. Now is not the time to be in close proximity with others. It is the time for staying at home as much as you possibly can. Stay at home and not to have visitors or to visit others. It is important to check on those who are most vulnerable to see if they need anything and to collect whatever they need, whether it be groceries or medications, and you can deliver these to them on their doorstep or on their porch that they can retrieve.
Yeah, so please listen to our healthcare professionals. They're leading the charge. East Liverpool City Hospital is doing a phenomenal job. Please share these updates with your family, friends, and neighbors. Obviously, not in person, but text it, share it on Facebook, and we can continue to prevent this virus from spreading.